All right, this is how to take a blood pressure measurement. So the first thing is that at this point, the participant has been answering questions on the computer just to kind of let their blood pressure decrease from walking in. This is the blood pressure machine. You want to make sure it's plugged into the wall. And I usually have this cuff connected here. Just the way that you connect it is you can screw and unscrew right there. But for Ryan, we're going to use the smaller one. I just like to keep the larger one plugged into it because we'll have larger participants come in and I'd rather have to go down on a blood pressure cuff than go up while they're here. So for the blood pressure reading, it's pretty simple. It'll tell you on here if you need to select a smaller cuff. It'll also have where their arteries should line up, and then if they should select a larger cuff as well. So the participants know that they'll be getting their blood pressure taken, so they'll probably have a short sleeve shirt on, which is good. So I just like to wrap this tightly around there. And then this cord should just fall nicely there. You want to make sure that their arm is relaxed as well. It doesn't matter which way it's pointed. Then you want to make sure that their feet aren't crossed as well. You just turn it on with the switch there, and then you're going to go ahead and hit start to get this reading started. Another thing to take note of too is you don't want them to talk while they're getting their blood pressure taken, because that can also cause it to increase and things like that. Typically while they're sitting here, if it's a normal reading, it'll be something along the lines of like 120 over 80. If it's 130 over 90, so if one of those numbers is higher than 130 or 90, then they're at an elevated blood pressure. So if that's the case, you'll have to fill out one of the forms here that we have just to let them know that it's slightly elevated. So Ryan's numbers look nice and healthy. He has 119 over 82 and then 76 beats per minute. So you would go ahead and record that. And then when you're done, you just take this off. And then I usually wait until after the appointment, and you just want to make sure that you wipe down both sides of the blood pressure cuff, and then I go ahead and wipe down the cord as well. And that's it.